Good morning, everyone. I'm just going to do a little housekeeping first, then I'll introduce Dr. Coleman to you. First, welcome to SunCloud Health's Adolescent Education Program. We're excited to have you here. If you have any technical difficulties during the presentation, please reach out to me via email at tgasser@galenmentalhealth.com. I'll put that in the chat in a few minutes, or actually, Sal, if you could put that in the chat for me, that'd be great. We're excited to have you here. And Dr. Coleman, thank you for coming today and speaking for us again. We've worked with Dr. Coleman for a little over 2 years now at SunCloud. He's a board certified child and adolescent and adult board certified in both adolescent and child psychiatry, as well as adult psychiatry. Dr. Coleman received his Bachelor's of Science in Chemistry after studying at both Washington University and Lee University. After earning his doctorate and medicine at the University of Louisville School of Medicine, Dr. Coleman completed his adult psychiatry residency program, as well as I noted, his child and adolescent psychiatry fellowship at the University of Illinois. Dr. Coleman has a love for education. He continually just tries to improve what we know about adolescent and child psychiatry. He works with UIC fellows and residents, and he's a regular participant in our studies here at SunCloud Health. So Dr. Coleman, welcome, and we look forward to learning from you today.
All right, thank you very much, Tammy. And welcome everyone to our continuing education series. Today I'm going to be speaking on creating safe and supportive learning environments. And so I hope that I'm able to provide you all some information that may be helpful. The majority of this presentation is focused on education and safe and supportive learning within school environments, but most of this information can be translated to other areas as well. And so again, we are looking for creating safe spaces. So objectives today, we would like to understand how safe environments affect learning. We want to understand the impact of stress on learning and development. We want to discuss effective modalities for supportive learning, and also creating safety within learning spaces. To begin, in order to create safe and supportive learning environments, we really must first work to understand the needs of students. So we'll start off with the question: which of the following are negative outcomes of unsafe and unsupportive learning environments? Increased depression and suicidal behaviors, less engagement in learning, lower absenteeism rates, decreased risk of victimization, or both A and B. And I'll give people a little bit to think about the answer, and then we will move forward. So in terms of risks that we see from negative or unsafe environments are going to be A and B: increased risks of depression and suicidal behaviors, less engagement in learning. And for C and D, the opposites are true. We will usually see increased absenteeism rates and increased risk of victimization. So I want to first discuss the term psychological safety. Psychological safety is really at the heart of creating safe learning environments. And this is the belief that a person will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. It's being able to take interpersonal risks without negative consequences. And this is critical in learning. There are many reasons for feeling unsafe in school, and this can be associated with a wide range of personal, school, or other social factors. And that's important to note, because not everything making a person feel unsafe at school is directly related to school. There are several negative consequences for feeling unsafe in school, which we discussed in the previous question. Increased risk of being victimized, increased risk of depression and suicidal behaviors, lower school attendance rates, and less engagement in learning. However, there are positive outcomes from feeling safe in school. It can allow for more positive identity development, can lead to increased engagement and interest in learning, and also better learning experiences, improved feelings of self-worth, reduced violence and increased personal safety, improved mental and physical health outcomes, improved attendance rates. All of this also translates to us seeing more students who feel safe in school progress through higher education or other graduate or development programs, or trade schools even. But again, when they're feeling confident and interested in learning, they have a higher chance of continuing education past high school. And again, when people are feeling unsafe or unsupported in school, there are higher rates of not continuing through other education past high school. Long term, we know that not progressing through education past high school does statistically lead to concerns about health, finances, a lot of other socioeconomic risks that are involved. So how do we teach our kids? You know, we're creating safe and supportive learning environments, but how do we teach them? Every person has a different learning style. And so it's really important to consider that every student is individual and that they are going to learn in different ways. Here are some different learning styles, kind of more the primary learning styles that we see. Verbal learners are really strong with words, writing, and speech. Visual learners like to use pictures, diagrams, spatial relationships are good for them. Musical auditory learners are good with sounds, rhymes, rhythms. Physical or kinesthetic learners like to do things by doing with their hands, sense of touch. Logical, mathematical learners enjoy logic, reasoning, systems. Social learners usually learn by doing things as a part of a group and do well with group projects. Solitary learners often like to work alone and use self-study. And then there are combination learners. You can have more than one style of learning. So what does this mean? What do we do? Because students have different learning styles. Well, there are tips and different strategies to implement for people with different learning styles. For auditory learners, you can have conversations about new concepts and things they've learned. You can say or repeat things out loud. You can make up songs to help memorize facts. Use book clubs, self-recordings, podcasts. Visual learners, using a whiteboard, charts and graphs, visual aids, drawing visual representations of what they are learning, bright or different colors, color coding, watching documentaries, concept maps. Kinesthetic learners, holding objects in their hands, as simple as that may sound. Patterns such as finger snapping or clapping to help with memorization. Using different textures of paper, a variety of pens and pencils. For verbal learners, reading and writing. Reading stories, novels related to current subject material, writing essays, retelling lessons in creative writing, learning using dictionaries and encyclopedias. Social learners, assigning group projects with clear roles defined, but making sure to allow everyone an opportunity to be the team leader. Brainstorming, learning through performance, book club organizations. Have them review another student's work. Role-playing, field trips. all things that can benefit social learners. Logical learners provide clear structure with rules, procedures, and goals defined. Planners and organizers using categorization, creating outlines, using evidence to support learning. Solitary learners, keeping a journal or a diary can be really helpful. Giving space to build trust, plan lessons around personal interests. But you also, for solitary learners, want to work to expose them to some social opportunities, asking reflective questions, small group work, but also with solitary learners, providing a quiet place to work. And again, for combination learners, you can use combinations of any of these strategies. There are more for different, but I did want to talk about some strategies for each type of learning. So, education should be inclusive in order to be supportive. So children have diversified needs. Every child is unique and requires continuous support and attention. You can use different assessment and evaluation strategies for different people, using mixture of various means and media, along with strategies of communication, which is what we just talked about, and having no fixed teaching style, because students demand flexibility in learning. So how do we do this? How do we make school inclusive? Well, it starts with teachers, and it starts with supporting teachers and helping to train them in order to support the diverse student needs. Redesigning facilities for accessibility, combating community stigma, by using student and parent forums. It can be important for schools to appoint a DEI officer, diversity, equity, and inclusion, but it's also important to invite others to help and participate. And then encouraging self-reflection in teaching, to understand how our own personal beliefs, how our own backgrounds affect how we present information to other people. And is it done so in a helpful manner? So establishing positive school culture. Again, it starts with the leaders. It starts mostly with adults, but there can be leaders at school who are not adults, who are students. But it starts with what leaders need to do. They need to assess the current school culture to determine where you are at, so you can decide where you want to be. You need to come up with a shared vision. This usually starts with individual personal visions and goals, and then combining those personal visions into a shared and cohesive vision. This takes compromise. Work together to create a new culture, and everyone should be included. Everyone should have a role, because everyone is going to be involved in this new culture. You also have to try to make the work fun, positive reinforcements, school announcements, giving kudos to people for good work, for effort. All of those things can build fun within the work that is done to build culture, which can be challenging at times. You have to have an effective team, though, in order for your vision to become a reality. So within building an effective team, you first, like I said, have to develop that cohesive vision and a strategy for implementing. Effective teams are able to communicate that vision to others. They're also able to empower broad-based action with that well-designed plan and not get focused on very specific minutia tasks. It's important to generate short-term wins. Many times when people build plans or strategies, it involves a lot of long-term goals. If it takes a long time to reach those goals, people can become fatigued, feel like things are not going to change. So building in those short-term gains and wins is very important. Effective teams are able to consolidate the gains they make and produce more change with that evidence, and then incorporate these new changes into the school culture. Within working to complete any job, especially building school culture, there are a lot of organizational considerations to factor in. And these are things that should all be discussed and planned upon, because these are the things that really make the process go. Logistics, timeliness, making sure that you're treating people on the team with courtesy and respect, understanding who is in charge of the decision-making process and how that goes, understanding the workload assignment and division of labor. No one person should be expected to do the bulk of the work. However, if there are people who want to do more work, that's fine, but no one should feel overburdened. It's important to set priorities and focus on the things that are most important and can be accomplished. And then you have to figure out a way to enforce the standards that you've set, making sure that all the things above are working as you have defined them to. So student-teacher relationships are going to be a critical part of building a school culture. There are significant positive impacts from healthy student-teacher relationships. Excuse me. Healthy student-teacher relationships can strengthen academic achievement. It can help reduce absenteeism. It can promote self-motivation. It can help improve self-regulation. It can help with improved outcomes in both social, emotional, and executive functioning, as well as improved goal-making skills. Again, this all translates to oftentimes students going through higher education after high school. So how do we improve these student-teacher relationships? What are some things that we can do? It starts by modeling expectations. If you're expecting students to have certain behaviors, courtesy, respect, kindness, you must reciprocate that and show it yourself first. It's also important to build routines to create a safe and predictable learning environment. Kids like structure. They may say they don't, but kids like structure. They thrive in structure. And having a routine allows kids to understand what's coming. It helps build trust. Greet students warmly and use their names. Again, showing them that you know who they are. They're not just another face in the crowd. Acknowledge or praise students for behavior and effort. So again, not just when they get things right, but when you know they're working. Because again, effort is really, really critical. And if people can learn to put forth good effort, then it's going to affect them long-term in life. It's important not to chastise students in public for negative behaviors. One-on-one is much more effective to discuss these concerns, and usually in private or with a parent present. It may seem straightforward, but you have to care about your students. You have to care about the work you're doing. You have to care about their, development and their futures. We have to understand and meet students' learning needs. As we talked earlier, students have different learning styles. If a teacher comes in and is rigid and only using one learning style, a student who doesn't do well with that is probably not going to have a good relationship with that teacher and see them as being unfair. Be consistent, be reliable. Again, this goes back to building routines, but do what you say you're going to do. And if you do that, you're going to build trust. Whether that's, saying that something good is going to happen, or saying the repercussion is going to happen, or a consequence, follow through. Know that you mean what you say. Understanding, again, how personal values impact how you teach and interact with students is very important. That's self-reflection. And then showing equity. And again, equity is equal outcomes. It's not everyone gets the same treatment. The best example I have of this, and I apologize for not having a picture, but you have 4 people, 3 who are mobile and can walk and use their legs and arms, 1 in a wheelchair. Well, it's equal to give everyone a bike, but not all 4 are going to have the same outcome. And so equity is figuring out a way for all of them to be able to have the same experience biking or a similar experience biking. Creating a community environment. So what are some things that can be done to create that sense of community? Celebrate students, celebrate teachers for their achievements with awards, recognition, student teacher of the month or week. But again, show them that you see that they are doing a good job and working. Keep staff informed of student achievements, both in and out of the classroom. And what I'm saying here is, students have homerooms, but it's okay for the homeroom teacher to go and tell other teachers about the good stuff their kids are doing. Okay. Share these things on social media platforms. Also, you have to make teachers feel valued and rewarded. It's so much work that they do to educate and help, and it just seems chronically undervalued. So finding ways, especially within the community, to make teachers feel valued and rewarded. You have to make time for culture building activities, like things like assemblies or pep rallies, activities that everyone can go to, teachers and students alike. Create special days for everyone to participate as well. Readathons, dress-up days, field trips, spirit days, school carnivals or picnics. It's good to have fun, and kids remember those things. Involve parents and volunteers. Again, the school is the students, but the school is larger than that. It's a community. It's kids, it's parents, it's relatives, it's local businesses. Involve them. Make them feel part of the community. Teachers and leaders should also be present and accessible. I feel like this is crucial. If you're trying to make change, the people that are going to be the recipients of that change need to see their leaders, need to see them modeling that behavior, need to see them be present, be able to interact with them if need be. Communication. Communication is also the critical part. All of these are critical parts, but the communication is extremely important in terms of building safe learning environments, as well as sense of community. What are some benefits of effective communication? Well, there are a lot. These are a few, but it can build long-lasting relationships, establish professionalism, breed trust, overcome obstacles, higher engagement in learning and other activities, and also just having more friends, more connections. So what are some different channels of communication? How are ways that we can communicate? Again, at schools, it starts with staff, and in any other institution, but it starts with staff and having regular meetings, being able to communicate what's going on, what are concerns, what are the positives that are going on, but having regular check-ins. Parent-teacher conferences are always a good way for communicating, but you don't have to just wait for conferences. Social media, apps, cloud phone technology, all are ways of communicating information quickly and readily to either parents or other colleagues. Digital newsletters and announcements are there. Social media, again, presence. And then student-teacher collaboration, so office hours or other projects or things to work on. I mean, there are so many channels for communication at this point in time. I mean, I'm an 80s, 90s kid, and I remember it was literally you got a student newsletter put in your backpack to take home once a month, and that was it. And there was a parent-teacher conference, but there are so many other modalities for communicating at this point. Becoming familiar with them and utilizing them can go a long, long way. So in terms of problem solving, so I like this diagram. Again, what are we trying to achieve? So in any kind of interaction, we have a goal that we're trying to achieve, and then there's the relationship between the people that are working together. And so if you value that relationship and you value achieving the goal, then learning how to collaborate is the best thing to do, because everybody wins. I mean, compromise is in there and it's not terrible, but again, no one person feels like they're winning at that point. Competing, avoiding, those are usually not the best thing to do. But again, it all depends on what your goal is and how you value the people that you're working with. I always suggest collaboration if it's possible. So conflict resolution skills, again, different things to work on in terms of that communication and how we proceed. First of all, you got to be assertive. You got to say, if there's a problem, if there's a conflict that needs to be resolved, you need to say, hey, this is going on. We need to work on this. Be assertive. Working on mediation while using empathy. Okay. Interviewing and active listening. It's important to listen. Don't interrupt. Let people finish. Okay. You also have to have a personal accountability, understanding that, everyone has their own piece to work on. And usually if things are not going right, it's not any one person's fault. It's a combination of things. And then get creative. If the typical solution to the problem doesn't work, I know it sounds cliche, but think outside the box. Brainstorm, use other ideas, and see what works. Not everything's going to work, but that's why we keep trying to solve problems using new techniques. Providing feedback is another crucial part in communication. And so as teachers, educators, we have to be able to give feedback, but we want to be able to give feedback that is constructive and feedback that is not going to just make a person feel bad or give up. So some strategies for this: be as specific as possible. If you just, the example is like an English paper. If a kid gets an English paper back and the teacher's remarks are, this is sloppy and not well organized. Well, what is a kid supposed to do with that? That's a very amorphous, non-concrete thing. Like, that doesn't give them any direction. It just makes them feel bad. Versus specifically like going through discussing, order and syntax and, thesis and themes and what can be done, but giving very specific feedback. Be timely in your feedback. Sooner is better than later. If you allow problems to go on, they will likely continue. That's not to say that step in the first time a person makes a mistake, because kids should also be allowed to have chances to make mistakes and self-correct. But if you're noticing it as a pattern happening 3 or more times, then that's where you can kind of step in and provide that feedback. But be clear on how the feedback will help the student achieve their goal. Okay. Present feedback thoughtfully. Explain the purpose and how it will help the student compete only against their personal best. I say that because feedback oftentimes can breed competition. And so it's important to understand that every student is there for themselves. They're not competing against classmates or anyone else. They're there to better themselves. So feedback is not comparing them to other students. It's comparing them to themselves and what they can do to achieve their personal best. And then help students be aware of how they are learning, so they can recognize mistakes and work to develop their own strategies for learning. Again, if you don't self-correct in a student, or if you don't correct a student and they don't self-correct on their own, they're going to keep doing what they're doing. So stepping in, showing them, different ways to do things can help them recognize what they're doing, and then they can develop their own self-regulation strategies for learning. Supportive teaching practices. All right, so another question. What are ways that teachers and educators can support learning in the classroom? Practice differentiated instruction, provide positive reinforcement for behavior and effort, continue personal professional development, be accessible and approachable to students, or all of the above. Hopefully, people answered E, all of the above. These are all things that we will talk about, but are all strategies to support learning, to support learning in the classroom. So I mentioned differentiated instruction. What is that? Differentiation means tailoring instruction to meet individual needs, whether teachers differentiate content, process, products, or the learning environment. The use of ongoing assessment and flexible grouping makes this a successful approach to instruction. And this is from Carol Tomlinson, who's done extensive work on this subject over the years. Always worth reading her stuff. And again, how can teachers differentiate? Well, they can differentiate the content they teach, the process by which they teach, or the product that they teach. But this has to be done according to the student and their readiness to learn, their interest in learning, and their learning profile. Again, what is their learning style or styles? And again, differentiation, before I talk about positive reinforcement, means tailoring again to that individual learning style and not having a one rigid teaching style. So positive reinforcement in the classroom. There are different types of reinforcements. So direct reinforcement, this isn't anything teachers have to work on themselves. This is peer-to-peer. So appropriate peer interactions are going to lead to future invitations to participate in stuff. And so the kids understand that, hey, I got invited back. This is good. Let me keep doing this. They can sometimes get the opposite message too if they're not invited back. And then they may understand that it may have been something to do with their behaviors. They may not, but again, that's direct reinforcement. Social reinforcers. These are comments of praise, good job, things like that. Written approval, nonverbal cues, a smile, a high five. You always have to think about personal boundaries in space, but when appropriate, a pat on the shoulder or something like that if a student is comfortable, but always trying to understand personal boundaries. Activity reinforcers. So this is allowing students to participate in preferred activities if they behave appropriately. This can be done at home, at school. At school, I give the example of, lots of kids, love social media and love tablets and things like that. So, a kid may really want to do that. If they are showing appropriate behaviors in class and things like that and showing good effort, maybe building in some time for them to do an online learning activity can be a good motivator. Tangible reinforcers, things like certificates, letters of praise written to parents to give to kids to take home, displaying work in the classroom. And again, when you're displaying work, you don't always have to, if it's things like art or not, display everybody's. Display what people have put effort into. Be cautious about giving tangible things like food or toys. Food, people may have dietary restrictions, people may have medical illnesses that prevent them, religions that prevent them from partaking in certain foods. And then with toys, I mean, just personally, I have a third grader and a first grader. And, you know, we're thinking younger kids for this kind of reinforcement, but I don't recall ever seeing a kid get a toy in a classroom and the rest of the class was not jealous. So got to be cautious about things like that. Token reinforcement is also beneficial. These are things like tickets or coins that can be exchanged for rewards at some point that are given for positive behaviors. The rewards too, again, we try not to do physical things, but rewards can be things like, you know, for younger kids, bring a book into the classroom that you really love and we get to read it as a class, or get to wear pajamas for a day, or you get to bring your favorite stuffed animal in for the day. You know, with older kids, it's looking to be creative, but oftentimes those token reinforcers that we're talking about are more for younger kids. Ongoing professional development. As I said, teachers are really critical in providing safe and supportive learning spaces. And in fact, I think probably the most critical part of it. So in order to continue to be able to educate and do well, you have to keep up with your own professional development. As physicians, we do this all the time because we got to keep learning so that we are doing things the right way. So you got to stay up to date with new research on learning, new tools for education, emerging technology, and new resources. Improve teaching skills and understanding student needs. So professional development can allow for teachers to improve teaching skills and understand student needs so that they can yield better learning outcomes. Professional development can help teachers adapt to the changes in educational landscapes, to understand social, political, or cultural shifts that may affect teaching. Professional development can also help renew existing skills to support students with special educational needs or disabilities. And it can also enhance professional knowledge, competence, and skills. And sometimes as an indirect thing, it can also lead to, you know, practical things such as pay raises or new jobs or promotions. It's not guaranteed, but it doesn't hurt. We've talked about inclusivity in the classroom, but what does an inclusive classroom look like? So everyone has a voice. Everyone needs to feel like they are able to participate. And that's that psychological safety that we talked about earlier. The environment should be welcoming and accessible and actively promotes well-being. Every student should be represented on the learning continuum and able to enter into learning. That's that differentiated teaching. A structure is in place to engage with and resolve challenges in a constructive and respectful manner, and the classroom is connected to the broader community. We're going to move on and talk about those latter two in a bit. So ensuring physical and emotional safety. So should be question 3, but what are ways to create safety within schools? So have signs at school that say no bullying, so there's no need for a formal policy. Have access to school counselors and mental health professionals on site. Have well-defined safety protocols for different crises. Allow the principal to determine school safety protocols. Both A and C, both B and C, or all of the above. Sorry, I felt like making one question where you actually had to read. So hopefully people picked B and C. And so we will discuss why A and D are not good things to do. So anti-bullying policies. So having a clear explanation of what is and what is not bullying. Anti-bullying policies should provide information on how the school builds a positive school culture and actively works to prevent bullying behaviors, not just what is bullying. How to obtain mediation, counseling, and peer support for affected students, including students engaging in bullying behavior. Because again, we want to help everybody. Anti-bullying policies should be clear, staged processes for the implementation of intervention strategies, other consequences, and follow-up monitoring. And directions to staff for the maintenance of appropriate records to monitor incidents and what has been done in progress. Again, anti-bullying policies need to be clear. They need to have sufficient information, policies, and protocols. A sign on the wall that says no bullying is not going to be effective for the larger percent of people. Mental health support. So it's important to have mental health support for students because it promotes the reduction of stigma surrounding mental health, and it allows students to identify when they or someone else may need support. Having mental health professionals on staff, counselors, psychiatrists, nurse practitioners, nurses, all can be invaluable for allowing students to feel that safe space in school. And it can help create that safe and supportive learning environment. It can help teaching healthy coping mechanisms. It can help with improving classroom behavior, social engagement, and peer relationships. And it provides invaluable support for many students who feel they cannot talk with anyone else about their issues. As a physician who works in a PHP program, a day treatment program, the majority of referrals we get are from kids struggling in school and counselors or teachers suggesting they may need additional help. So, crisis management. Kind of different phases of crisis management. There's prevention and mitigation, so averting or lessening the impact of a crisis. Phase 2 is preparedness. This is planning, having drills, training, being ready for it. Phase 3 is the response, the emergency management, triage assessment that happens during the actual crisis. And phase 4 is restoring the learning and teaching environment. And so safety protocols are built in for these crisis management. Unfortunately, in today's age, we do have to have safety protocols for things like lockdowns and evacuations. Safety protocols now around COVID and illness, parent-student reunification procedures, mobilizing school transportation during the school day, emergency communication protocols with parents and the media, mobilizing mental health services. And so safety protocols and crisis management is a team effort. And so the question I posed initially, one of the answers was the principal should make the safety protocols. Safety protocols, crisis management plans should be worked on by the school staff as a whole, and understanding and making suggestions, because again, when only one voice is there, we're missing lots and lots of good ideas. So it should be a team effort in terms of building. Community and parental involvement. So we mentioned including the community as a large is an important piece of developing safe and supportive learning environments. So what are some advantages of community involvement? Well, it's easier to get a better understanding of a child's needs when family are involved and communication channels are open. It allows for shared responsibility and accountability with family. It lessens the teacher burden of feeling individually responsible. It can lead to increased student achievement, improved attendance and behavior, increased rates of continuing to higher education, improved school reputation, and allows schools to improve practices with outside feedback. One of the interesting things here as I was putting this presentation together is that I got to this slide and I started realizing all of the improvements and positives from all these different things, student-teacher relationships, feeling safe at school, engaging the community, they're all the same. Improvements around in academic achievement, in mental health and physical health, in going to higher education. I mean, and so when we're looking at it, if you're doing all of these things, you're probably going to have all of these same outcomes, but amplified. And so this is the goal. This is why hopefully we became educators and teachers. So that's why we want to try and involve everyone and see these results come into play. So what are some things that we can do for community involvement? There can be things like internships or shadowing experiences for class credit through local businesses, school visits from local professionals or career days, workshops with community organizations, offering opportunities for volunteering and mentoring, inviting families to school events, student projects that focus on community improvement, and partnerships with local businesses. And here's the thing. Businesses and things are oftentimes not going to reach out to schools. Families may not reach out to schools. So it does fall upon the school to start reaching out to families, to community, to businesses, to try and build these relationships, strengthen them, because there can be a lot of advantages to go from there. And again, showing local kids in their areas like, hey, this is what you can do with your education. These are things you can do, and getting firsthand experience through those things like internships, career days, shadowing, workshops, all can provide a lot of positive experience and something that's different than just sitting in a classroom. So monitoring and evaluation. For all of the things we've talked about, it's going to be extremely important to regularly assess the progress and the satisfaction to allow for continued growth and refinement of supportive culture. If you just do the first step and you say we're good, things aren't going to continue to change and grow. Culture continues to grow and change, and we have to grow and change with it. We can utilize surveys and feedback from students, parents, and clients, which is invaluable to determine if things are working or require change. And we have to continue to be open to making changes to improve outcomes, even if it challenges the way things have always been done. And we have to do this based on feedback and data, and not just our own personal beliefs. And that is the end of the talk. I will open it up if there are any questions from anyone in the audience. I would be happy to try and answer them. But I would also like to give a thanks to SunCloud and Galen Mental Health, Dr. Kim Dennis, Dr. Alexander Chevalier, and also for everyone who came here today to hear this. So thank you.
So Dr. Coleman, can you give an example of when you're working with children with special needs, specifically high profound autism, profound Down syndrome, when you're working with those children, what are some ways that you would help the class be more inclusive of those children and keep the learning level? I think that's the question that's being asked.
Right. So everybody is, so in these cases, I've actually worked quite a lot with autism, though not directly in teaching younger kids who have autism. So one of the things is that the kids may be on different levels. Now, autism itself does not mean lower intelligence. It is a illness of social, communication, an issue of interconnectedness. And so, one of the things to do with that is assigning small groups, I think, is really beneficial, like 2 to 3 people, and, basically like letting the kids know, kids are receptive, kids are observant. They recognize when other kids are having issues. And you're talking about like severe autism is what I heard, not like mild autism. And so with severe, it's really trying to understand your class, understand the kids in the class that are tolerant, that are patient, And those are the ones I would probably assign to a group with someone who had a higher level of autism, and even explaining to them that, this student may struggle at times. Just try and be patient with them. But again, I would usually try and look for like temperament and personality of the kids that I would place working with them. But a lot of small group work can be helpful to try and get them into that. Again, if it's severe autism, those students may still continue to have those challenges with social connectedness, and may not be able to feel as connected. The other thing looking at it is, if the student with autism, it like seems happy enough being by themselves, then that's okay too. And just really tailoring to that kind of solitary learning style. Now, a lot of kids with autism are going to do well with like kinesthetic learning, hands-on type learning. And so those are other things to look at.
Okay, great. Another question is, and I think you expanded on it a teeny bit. Can you expand a little bit more on trauma-informed practices in a supportive learning environment, specifically to when you're working with somebody who you suspect is experiencing some sort of, like, let's just say, abuse at home? What are some ways that you can really help that child? And I'll give an example of, I was an educator before I became a social worker. I had a young man who the mom worked nights, no father in the home, and was up all night with an infant child. What are some, and that's just probably one of a million examples that we could give, right, of somebody who's experiencing some difficult times at home, and then we get them in the class when we expect them to learn and focus. What are some really good things that you found that would help a student excel in an environment that's very difficult at home?
Yeah, so in terms of practicing psychiatry, I'm always looking to get at the root of the problem. And so kind of, I would really try and address the home issue. And so that's where, if I would work to build trust and rapport with the student, like I said, by being reliable, by having a schedule, by being empathic and talking to them. And at some point, I would pull the student aside and I would state my observations. And I would say, hey, I've noticed that, you're coming in, or you had like a bruise, or your clothes have been dirty, or you look really tired, or, you seem to have been more distracted. Is there anything going on? Is there anything stressing you out? And then, hopefully the child is going to open up. Now, kids are not always going to talk about trauma. And so we have to look at the behaviors they're exhibiting. And so that's where it is really important too, to have like mental health professionals within the school. I would always refer a kid like that to the counselor. And honestly, I would reach out to the parents too. I would really quickly reach out to the parents if I noticed this and say, hey, I'm seeing all this, what's going on? And again, trying not to blame the parent or anything, but coming across as, I'm just concerned. I'm seeing these things, my job is to educate. And I feel like, that your child is not, able to focus as well, and just want to see if there's anything, we can do to help support you. And those can be good kind of introductory, conversations. And I've talked to parents before where, again, not as a teacher, but as a physician, where I've talked to parents based on the kids' observations, and the parents just kind of break down and like, start talking about all the things that are going on and how stressed they are. And, even in those times, like offering, to, look into family counseling, look into family therapy and support. Maybe the parent needs therapy or support for themselves. Trauma-informed care is really difficult, but those are some of the steps I would take in terms of mitigating that.
Yeah, and to back that, when I was an educator and this young man I was talking about, I had called his mom at home just to say hi. I checked in I think checking in with your students' family at the beginning of the year and introducing yourself when there's not a bad thing going on, when you can call them something positive, is good. So I made it a point to touch base with every parent at the beginning of the school year. When I called this particular mom, I said, and he was doing well in school. He was really trying. And I praised him. And she said he was a ninth grader, had never received a phone call from one educator saying something positive about her child, and told me he was about to drop out of school because she didn't think it was for him. Started, getting the family connected with services, and he ended up graduating, first person in their family to graduate high school. So the value of educators is amazing, and relying on us as the mental health professionals to help you is really great. So I greatly appreciate you speaking today, taking the time. If you're on the call still, it's right at the time where we're about to drop off. If you have any questions, you can reach out to me directly, or you can reach out to Christy. Her number is here. Everybody have a great day and a wonderful weekend.